And when it comes to details, multiple outlets are reporting the Prime Minister will be offering billions of dollars in new funding, but also saying it may be weeks before deals are actually signed. For some reaction, we're now joined by Dr. Alika Lafontaine. He is the president of the Canadian Medical Association. Dr. Lafontaine, nice to meet you finally face-to-face.
Yeah, thanks for having me.
So we're starting to get an idea of what's going to be on the table tomorrow. As I said, billions of dollars from the Prime Minister being offered to the provinces. And along with them, a number of side agreements and this cautioning that perhaps by end of day tomorrow there will be no deal signed. So let's break that up, beginning with this idea that deals may not be signed by end of day tomorrow. What's your reaction to that?
So I think it's really important for us to remember we are still in the midst of the worst healthcare collapse in the history of health systems in Canada. So patients are having a difficult time accessing care. Sometimes when they are sitting in waiting rooms or emergency rooms, they end up not receiving the care they need and sometimes having very severe outcomes as a result. And so speed of signing these deals is extremely important. We do know that we're getting more funding or expect to get more funding to provinces and territories. Now the real question is, where is that funding going to go?
Mm-hmm. And where do you hope that funding goes? Where are you worried that it might actually get ignored?
You know, I think the real fear for bilateral deals is we migrate from doing the necessary to doing the achievable. There's certain things that have to change in Canadian healthcare for us to improve access to Canadians. You know, pan-Canadian licensure is one of the things that will help to alleviate patients' difficulty accessing care because it'll make it easier for people to move from one place to place. You know,
and by that you mean from province to province to province to
province to province, jurisdiction to jurisdiction. You know, I live along the border of BC. I choose not to practice in BC because the process of registering for a license is both timely and very costly. And so, you know, moving towards a national type of way of managing our workforce is really, really important. You know, making sure that we move towards team-based care where people can distribute the workload of care and having patients walk in through multiple doors to get the care that they need. You know, that's a really important thing. You know, all of these things can migrate towards sounding like innovation, but still being more of the same. And that's actually what I'm very afraid of when it comes to these bilateral deals.
Mm-hmm. And I guess part of it, too, is that when it becomes the, you know, there's not a one-size-fits-all. The worry is that there will be one jurisdiction that perhaps gets less from another then.
Well, you know, I think it's less of a worry of getting less and more moving towards ways for us to understand what our actual needs are. You know, back in November when they were talking about, you know, national data sharing and a national workforce plan, you know, baked into that is the ability for us to actually know where patients need things and the skills that providers need to have in order to satisfy those needs. You know, when we talk about things like licensure and healthcare teams, you know, it's all about working differently because it's going to be difficult for us to increase our numbers in a short period of time. And so, once again, it's focusing on the what now that we know that the amount is higher.
Mm-hmm. The amount being higher. Does that at least give you some hope that the amount is higher? Although, to be fair, Dr. Catherine Smart, who's your predecessor, did say last summer that it's not just about money.
You know, I think the federal government has been consistent that it doesn't have a problem with spending more money as long as that money goes to the right places. You know, once again, if we move away from a pan-Canadian deal towards kind of one-off deals with each province and territory, there's a difficulty that gets introduced where we might be too specific. You know, we may be too localized, when really a lot of these problems are big problems shared by the entire country. There's not a single jurisdiction that's doing a great job at access to primary care right now. There's not a single jurisdiction that, you know, has too many family docs, for example. So, you know, what Canadians want is solutions that actually fix the root causes of these problems, and that can get lost in these bilateral deals.
Mm-hmm. And you know, to that, I also want to bring up the fact that there was, or is rather, an Ipsos poll that came out today, and it found 60% of Canadians are now in favor of private health care for those who can afford it. Healthcare, public health care, has been this sacred issue in this country, and now you have the majority of Canadians saying, well, maybe it's time for private health care. What do you make of that number?
You know, what I read that as is 60% of Canadians recognizing that access is so severe of a problem that we have to think about other options. You know, the major problem facing patients across the country, regardless of which province or territory that you're in, is how do I actually access care? You know, and then once I can access care, how do I make sure that that's the right care for me to receive? And so we can go about investing in different ways, but once again, we have to be focused on the right types of things. Private care is a tool, it's not a solution. You know, what's our real solutions to healthcare? Changing the way that we work together, making sure that workers can go to the places where they're needed, and a real focus on access for patients. And I think investment in the public system is the best way to do that.
So again, the First Ministers meet tomorrow. We've heard a little bit from the Prime Minister, a little bit so far from the Premier of Manitoba, who's chairing the Premiers right now. What is your message to the First Ministers?
You know, my real message is that every moment that we wait to have these deals worked out is acceleration of the deterioration of what's happening in health systems right now. You know, patients are not getting what they need. Providers are in situations where they're having a hard time being able to bring care to patients that need them, and as a result, it's very, very demoralizing, more so than ever that I can remember. You know, and the other message is that we need to focus on doing what's necessary, which isn't necessarily what's easy. You know, I want to see coming out of these meetings that we're focused on doing hard things. You know, it's in the hard things that we're actually going to fix the healthcare system.
Well, I know you'll be watching closely tomorrow. We'll be watching, and perhaps later in the week you and I will speak again. But for now, Dr. Alika Lafontaine, thank you.
Thanks for having me.